Hello, everyone. Today we have special guest Dr. Amy Robbins with us. Welcome, Amy.
Thank you.
Thank you. It's really nice to have you on. I'm kind of intrigued to get answers to some of the questions I've written up for you today. So let's start off by you're a clinical psychologist, you're a medium. Let's start off by talking about that a little bit. If that was always your intention to blend both of those, or if you kind of came into that later.
No, it sort of stumbled into me more than I stumbled into it. So when I was 18 years old, I lost my aunt. She had juvenile onset diabetes. She was waiting for a kidney and pancreas transplant. And while she was waiting for the transplant, they needed to make sure her heart would be strong enough to withstand the transplant. And when they went in to check on that, they had realized that she had had several heart attacks previously. And so they needed to go in and repair her heart. And when they went in to try to repair her heart, it was just too damaged from the heart attacks, from the diabetes, that she ended up dying on the table. And I got the dreaded call that so many people who have lost someone they love get, where you think, well, you either think nothing's going to happen, or I knew she was going into surgery. I thought, oh, okay, she's going to go into surgery and she'll come out and she'll be fine. And she'll, we'll get back to life and she'll get her life back because she'll be able to not be on dialysis anymore. She'll get a transplant. Obviously, that was not the case. So she was actually my age now. And that now obviously has a whole new meaning to me because I recognize not only how young she was, but how much life she had left to live. And this was really the first death that I experienced that is what I call an out of order death, meaning that she wasn't supposed to happen that way, right? Like her parents should have died first. I hadn't really lost a lot of people close to me in that way. I had great grandparents that had passed away, but I still had all my grandparents. So it was really traumatic for me to have experienced that, to watch my mom, to watch my grandfather bury a child. All of it was just very intense. Fast forward to graduate school, and there was a lot that happened in between there, a lot of anxiety and um, just kind of, I always say, like gripping the wheel of life because of what happened to her. I felt really anxious that what happened to her could potentially happen to me, even though I didn't have diabetes. She was the first of three kids. I was the first of three kids, same birth order. Like there was a lot of sort of associations that I had made in my own mind about why my life could potentially end up like hers that weren't rational in any way. But the grief, the anxiety, first death, like all of those sort of psychological factors. And then I was in graduate school for clinical psychology. I was in my second year of graduate school, and my cousin was getting ready to get married, and my aunt came to me, and what I now know was a visit. Then I thought it was a dream because I didn't know better at that point. And she shared with me, she showed me this image of my mom standing at our kitchen sink, and she said to me, don't be upset. Let her know that I'm going to be at the wedding. And then she showed me a picture, an image of my uncle, her brother, and she said, let him know I hear him when he's speaking to me, when he's out, pushing the stroller, when he's out walking. I know he's talking to me and I hear him. I wake up from this dream visit. And I remember feeling like she was like leaving the room, and I wanted to just grab her and say, no, stay longer. I want to talk. My dog started barking. And I turned to my husband and I said, Aunt Linda was just, he wasn't my husband at the time, but I said, Aunt Linda was just here. And he said, what are you talking about? I'm like, she was just here. And then I shared with him what she said. And then as soon as I could, I called my mom and I said to her, I had this crazy dream last night. Aunt Linda came to me. She said that she wanted you were standing at the kitchen sink. She wanted you to know she's going to be there. She's going to be at the wedding. And my mom like choked up and she said, I was standing at my kitchen sink last night talking to her, telling her, I can't believe you're not going to be there. I can't believe you're not going to be at this wedding. And then um, my uncle, same thing. I come from a very materialist scientific background. My uncle was a doctor, my grandfather was a doctor, lots of like medical belief system on that side. And when I shared it with him, he said, that's when I talk to her. Those are exactly the times I communicate with her, is when I'm out walking. So I knew that there was something different about this experience, but I really didn't know what to make of it. I went to school that day and I reached out to a professor of mine who was teaching traditional psychotherapy, but also indigenous healing practices. And I shared with her my experience, and she said, I think you're opening up to something, and I think you should keep opening up. She gave me some Sylvia Browne books to read. This was before, I mean, this was 25 years ago. So there was not, everybody on social media as a medium. Like, people were not talking about this. She gave me the name of a medium that she knew very well. And she said, I think you should give her a call and work with her. And here I am, I'm 24 years old. I'm in the midst of a 5-year graduate program. The last thing I can do is explore all of this. So I didn't. I really put it aside. And then when my grandfather died about 7 years later, it happened again. And then it started happening with patients' loved ones, where they started coming into the session. And I was like, okay, I have to get a handle on this, because I can't, things in my house were going crazy, lights flashing on and off. My husband didn't understand what was going on. He is definitely um, not a believer in any of this. And he was like, something is crazy here. So yeah, so that was when sort of the journey really kicked into gear for me.
Okay. So, is this something that each time you're in sessions is a part of the session, or does it not happen with all clients?
No, no, it's actually once I started to get a handle on it, and I really kind of wanted to better understand like what readings are like, I did reach out to that medium again that my professor had given me years ago, and I started working with her. And we worked together for a couple years. And then again, it sort of like fizzled out. And I was like, oh, that was really interesting. I learned a lot, but now time to kind of get back to my clinical work again. I mean, it was working this whole time, but and then I had an experience where a friend reached out to me and she was like, I heard you're interested in this. I'm interested in this. Would you want to try to do a few readings together? And I said, sure,
Mhm.
I'll practice and see what happens.
Mhm.
A friend of mine came over that I was not particularly close to, and her father-in-law came through in the reading. And I shared with her I don't even remember, because when I'm in that state, it's very difficult for me to remember even what is coming through. I don't remember it after. It's just like whatever comes through, comes through.
Mhm.
And after the session, I had said to her, I see this gold ring with a blue stone on it. And it was very clear to me. I described it like almost like a graduation ring. And she went back to her husband, because the messages were really her father-in-law, her husband's father. And she came through, she said to him, Amy had this reading. She told him everything I said in the reading. He was like, yeah, maybe, sure. My dad could have said that. And then I told her about this blue ring, and he said, no, my dad didn't wear any jewelry. That's definitely not from him. He goes home that next weekend, and his mom as soon as he walks in the door, he lived in Philadelphia. Mom walks in the door and she says, I found this of dad's and I feel like he'd want you to have it. And it was the ring exactly as I had described
Mhm.
it. So he felt validated. I felt validated.
Yeah.
And I thought, okay, maybe there's more to this. And I did my own 3-month medium internship, because I'm so academic that everything I do has to feel like, oh, I practiced and I trained and I did all the things. And I just had people come in just for readings. That's all I did it was supposed to be 1 month. It ended up being 3. And it was meaningful, but it wasn't as rewarding as the clinical work that I loved
Yeah.
doing. And so I
Yeah.
kind of said, you know what? I don't want to do straight readings. I couldn't really figure out how to integrate the two, because no one was really doing that. Or if they were, they weren't talking about it. Now I think people are much more.
Mhm.
And I went back to traditional therapy, and I started my podcast, which was talking all about the intersection of psychology and spirituality. And
Mhm.
so I will get intuitive hits sometimes. I will get once in a while a loved one who will come through in a session, and I will share it with the person.
Mhm.
Sometimes I have to be careful with my intuitive hits, because sometimes they're psychic hits and I don't want to necessarily share those, because I don't want to influence anyone's outcome. And that's not why people are coming to me. They're really coming to me for therapy.
Yeah.
And so I really try to keep I personally have tried to keep those two more separate, but the more my patients knew that this was something that I could do, they were open if the information came through. But for me, I really have to sit and hold the space differently than I do when I'm working clinically. So like I did have a patient whose father came in. It always comes through for me on my right side and when he came through, it was like so loud. I couldn't even shift anything. I couldn't think. There was no, I felt like I had no choice but to share with her what was coming through. And she
Yeah.
validated it all and said, yep, absolutely. That's my dad. And he came through with some very evidential pieces, but also some more fun-loving pieces. And I think it can be a really, really profound part of a healing journey for people.
Absolutely. So do you actually see these loved ones, or do you just kind of get a sense of who they are and what they want to say?
Yeah, for me, it's much more of a clear audience, clear cognizance. Like I'll hear or
Mhm.
I will just know immediately and just sort of share that information. That's how, and it's not surprising because I'm such a auditory person. I listen for a living. So
Mhm.
the fact that that's how I would get the information makes sense in terms of my personality and how I work, that it would just come through as if I'm listening to them.
Right. So is this a skill that you need to be in person with your client to have, or is this something that you can do remotely with people?
So I don't practice it. I don't practice mediumship right now as
Mhm.
part of my clinical practice unless it just shows up.
Mhm.
And I mean, I've had it in those visits, those like dreamlike states too, where I'll get messages for people, for clients. So they don't have, their energy does not necessarily have to be in front of me, but
Mhm.
I personally would be careful. Like if I had a visit from someone, I would be very intentional about how I would share that in the context. And I would hope that when spirit would come through to me and communicate that with me, that part of it would know that how I'm going to use that information is going to be judicious in the context of a session. So there would be some people who I might not share directly, like your father just came to me and this is what he shared. I might use other language because not everybody's receptive to that, but I might use other language to share with them information that um, isn't as straightforward as spirit told me X, Y, and Z. I might be curious about something. I'm just curious. Have you ever thought about, this? And then when they validate it, oh my God, yes, that's exactly how I feel, or yes, that's exactly how I'm thinking about it. Then I'm like, okay, that's the validation I need. And they don't necessarily need to know that that is where it came from.
Right, right. So I'm going to pose this question, and I have no idea if you have any interest in this arena or not, but I just want to bring it up, and maybe Athena wants to weigh in too. So I follow a site, I've mentioned this before, Raising Vibrations, and sometimes some of the stuff they have on is repetitive. And sometimes there's things that interest me because I'll see it on there, and then all of a sudden I'll have it occur in my experience. And there's been a lot of solar flare activities, a lot of people. Athena has talked about the acceleration of things coming up to be healed and people going through bouts and icky stuff. And last night, Robin and I have the same parents, obviously, we're siblings. I've only had this happen a couple times, but my mom was in the dream, and it was in the house I grew up in. And it was a very kind of almost a dark scene. And there was a big closet. Robin, do you remember the big closet in that big bedroom that was so deep and kind of creepy?
Yes, yeah.
And that closet was in the dream, and going in it and thinking something was inside, and me being outside and just being panicked about it. And so I'm wondering, and maybe I don't know who wants to weigh in on that. Do you think that it's just like a release, or is that what's occurring right now? Is anything that is dark or wanting healing will come to you, whether it is in dreams or your life of, having a down day of emotions, that it's just trying to kick out the stuff. That's kind of the feeling I got from this dream.
I don't know. Robin, did you want to go or did you?
Well,
Yeah.
I think that's accurate. I mean, that's what I had a recall the other day, which I found really odd. I get it occasionally. I've had it a number of times, but it came back again, of a kid behind me taking a very thick book and hitting me over the back of the head with it. And it was one of those moments where not only was there shame, humiliation, pain, embarrassment, like there was just a brush of emotions, and it's come up to me a number of times, and each time it seems to be recalled, I kind of uncover another emotion that was attached to it. There was almost a sense of, because I was a chubby little girl, and maybe the boys didn't like me very much, and this popular boy hit me with the book. It was almost a feeling of I deserve this somehow. I'm not worthy, and I felt humiliated and ashamed and embarrassed. I felt nothing negative towards him for doing it. And in some sense, when I look back on that, I think that was really probably an accurate way to look at it, because I was the one that called that experience to me. I could blame him, and think that he was a terrible person for doing it. But actually, I held a lot of low self-esteem, a lot of not belief in self, lack of confidence. So I held the emotional basis that completely matched that experience. So on occasion, that one has come up for me over and over again, each time bringing it with another set of or feeling of emotions that provided me with. And I really am a believer that we are in a period of acceleration of frequency, and that is not going to permit us to hold a lot of lower tone emotions. And, a lot of people, and I hope I'm not veering too much off of topic, but there are a lot of channels that are maybe channeling some information that makes people uncomfortable or worried about what the future will bring. And my group just recently spoke to me that there's going to be an acceleration in frequency where there's going to be a lot of people that rise in consciousness. So in other words, people will start to do really well. They'll start to come in connection with higher aspects of themselves that they didn't even know existed, that are very confident, that are very capable, that are prosperous, maybe in ways that they never thought would ever develop in them. And that acceleration of those people who are moving into a higher frequency, they're staying on Earth, but their consciousness is rising to a higher frequency where they have availability of happiness, joy, emotions to create with that feel really good, instead of maybe the ones that we've had for a long time when we've been in density. And so that acceleration of frequency for those that understand it and those that are a part of that movement or that collective consciousness that is expanding, they're going to accelerate very fast in a very positive direction. And others who are stuck, maybe in third density, who aren't really ready to move yet, maybe don't have that belief or concept, it's going to appear to them that they're suffering more, but they're not really suffering more. They're just kind of staying where they are, but the other people are rising at such a fast and quick rate that the distance between what they are observing in others and where they're finding themselves stuck in, and really that's what's meant to happen. It's a stimulation to them to start moving, to start going into that direction. But rather than say that there's going to be a fall or a decline in humanity, I would say there's going to be some people who are going to maintain, and there's going to be some people that accelerate a great deal. And then looking at that disparity or that difference between the two is actually more of what's being observed than it is an actual decline or a bad time that's coming. That's how I would describe it, if that
Yeah,
makes sense.
yeah, it does.
Mm-hmm.
Um, so, so when you have someone in your that comes to see you, and they're in a mental crisis, do you find that sometimes that's associated with a spiritual awakening, that maybe there's some things going on that are throwing them for a loop and they don't realize the connection between the two?
Yeah, I mean, I think that many of our mental health symptoms and crises are spiritual calls for the soul. They're spiritual calls of the soul. And that is not to discount that there can be real chemical issues in the brain that need to be treated. That does not. I don't want to negate people's experience, because I think sometimes people hear that and they think they can get really angry, which again is an invitation to look at why there's the anger around that. Like, I think anything that stirs up feelings in people is an invitation to go deeper and to better understand. But I don't see symptoms as like, oh, you are panicking, your mind is racing, you have sweaty palms, you have anxiety. I think, okay, those are symptoms. It's your body and your mind's way of telling you that something is off, and we have to get to the root of what is off.
Mhm.
And oftentimes people know deep down, it's just really hard to listen to those cries because those cries usually mean you need to change things in your life, and change is uncomfortable. And that means you need to face things. And that means you need to look at yourself and really dig deep to understand why am I exhibiting these symptoms? I mean, I remember, sort of my lowest was after I got out of college and I was working in this job that I hated, and I was totally miserable, and I was pretty depressed, and would like I had a horrible job selling radio airtime before I decided to go back to graduate school. And I had this amazing degree from this great university, and I had this job that I hated, and I could like the two, and I was living at home and commuting, and everything just felt out of alignment. Like it did not feel like I was in any sort of way doing what I wanted to be doing. And I understand that when you're just out of college, you don't always get to do everything you want to do, but this did not feel like I was on any sort of path towards that. And I was in a really dark place. I was very, very unhappy, very anxious. And I could have kept on that because I had this degree and I had all of these beliefs about what this degree meant and what I needed to do with this degree and what it would look like if I stepped back and didn't stay on this traditional path of job and then another job and climbing this ladder. That was all that I could see. But I was so unhappy that it was a cry like, you have a choice here. And I quit my job and I waited tables for 9 months, I think, 6 to 9 months. And I volunteered and took some time to figure out. Luckily, I had parents who were very supportive of me and allowed me to continue living at home while I did this, and figured out and saved a lot of money waiting tables. I worked any shift I could and figured out what it was that I really, really felt like a calling to me. And had I gone in and I was in therapy at the time, but had the therapist medicated me or said, here, take these pills, you're experiencing a depression. Yeah, symptomatically, sure, that's exactly what it was. You could look in the DSM and I would probably have met the criteria for depression and anxiety, but that didn't tell a story at all of what was going on with me. And so we always need to understand people's stories to understand what is really happening here, because oftentimes it's a spiritual call, whether it's a cry to get out of a relationship, a bad job, a bad living situation, whatever it might be. Those symptoms are usually a cry for that.
Right, right. So I know that you said it when you first started, this was not real common to have mediumship combined. Are you aware or do you see more and more of this occurring in practices? And if so, where do you see it going, say, in the next 5 to 10 years, as far as that?
Yeah, I think it's mediumship, but it's also the integration of these spiritual experiences. So we are inducing these now, right? Many people are using psychedelic drugs now. There's a push, excuse me. There's a push for legality of those medicines, those drugs. And so people are having these spiritually transformative experiences. And I think they're having them more than they're talking about them in therapy. And so this has become a real passion of mine. I just developed this online course called Spiritually Informed Therapy, where I want therapists to be aware of all of these experiences and other tools that are available to people, whether it be mediumship, people who've had near-death experiences, psychedelic experiences, but also people that are using some more non-traditional occult to non-traditional practices that were previously considered occult practices, like astrology, numerology, human design. There's a lot of these practices that people are seeking out on their own that I think can be rolled into therapy. And there are some therapists doing it. There are certainly some therapists that use mediumship in their work. Obviously, hypnosis has been common. People have done past life regressions, but the general field, I don't think, is aware of these things. And I think they are important other healing opportunities for people. And I would love the psychological community to be more open and willing to embrace these experiences, because I think that when you've had them, they are so profound that you can't deny them. And yet, if you've had them and you don't feel like your therapist would believe you, then you're missing an entire opportunity to heal. And that to me is a real disservice to the people that we should be in service to, which is whoever sits before us.
Right. Did you want to weigh in on that, Robin?
Well, I mean, just going from my experience, there's a lot mentally that goes on when you become a channel. And recently I had light language added, so that's another level of strangeness that's happened. And just surrendering. And I spent over probably 25 or 30 years before I became a channel, just reading and absorbing all the information and material I could, like the Sylvia Brown, all of it. I mean, I've read hundreds and hundreds of books. It was just a passion, something that I really enjoyed. Now, had I not done that, had I had a spontaneous experience where I just started channeling, but I had no knowledge or any background of study at all, I can see where you could think you were crazy. Or, there have been people that, I think one of my sons told one of his friends what I was doing, and they said, I think your mom needs some psychiatric help. And, I feel I'm as normal as I've ever been. There's nothing really changed about me. I don't find myself to be special or to grander anything that I do. It's just it's just, I understand people that maybe can't accept it, or they haven't had an experience, or maybe have no background at all with something like what it is that I'm doing. So I don't have that expectation of people if they deny the experience or don't want any part of me because of it. That used to bother me a little bit in the beginning, but now I've been doing this a number of years, and I recognize that even a spiritual awakening is something that the body really has to be ready for. The energy centers and the chakras all are opening up to be able to receive a higher frequency information. And that's really a part of that. It's part of your belief and your trust and your knowing comes through that higher frequency. And I'm not at all indicating that someone that doesn't have that belief is a lower level being. That's not what I'm saying. But I'm saying there is something physical to it too. It's not necessarily just a mental thing. There is a physical aspect to being able to receive that information. And so I can only speak for myself that it's been sometimes difficult because you look at yourself and you think, I look like I'm crazy right now, but yet there's a knowingness inside of you that there's absolutely no way that I could do what I'm doing by myself. And, there's just no way. And then the great benefit that it seems to be to people that I do have as clients is what really keeps me going in that direction. There's something that happens when you connect and you start to believe and perceive yourself as something more than a human, that does that drives you, that actually pushes you in that direction. And, as I was listening to you, there are many people that actually channel or do what you're doing, and they incorporate it into their businesses, and they like to do it anonymously. There many I could mention that are quite famous that actually do that are channeling, but they don't really say that that's what they're doing, but they know that they're moving into a state where flow is entering them. And it's very much your desire to use any information. You're open to it. I'm going to use anything I can to help this person. And it happens to come from up there or from right out in front of me. I'm going to apply it and use it. And I think that's a great way to do it. There's certainly nothing wrong with it. And further, it also it opens you up not just to the professional people and world that you're working in, but it also opens you to all of the other people that maybe hold some different beliefs and values in combination with that. And I do think in the future, Heidi, that we are headed in a direction where all of these things that you mentioned, we're gonna do everything. We're gonna apply everything that we can to the health and wellness of people, and if it works, we're gonna use it.
As we should, right? We should be able to use whatever tools we have available as long as we're not doing harm.
Right. And to comment further, I've had sessions with people who have been dramatically depressed and gone through things, and they're on medication. And the first thing that my group will tell them is to love the medication, because when you're in a depressed state for a long length of time, the chemicals in your body just aren't producing in a direction that they used to. And, to use a tool like a medicine or a therapist or somebody to help you getting back on track, the name of the game is feeling good. That's what it is. And whatever means that you need to take to do that. But, part of it is accepting what you've chosen. And if you're going to swallow a pill and every day dread it and think that you're a
Right.
bad person for needing it, it's not going to benefit you in the way that it could if you would just accept that you're lucky to have this and be grateful for it, and apply whatever tool you can to get yourself feeling good. Because when we're feeling good, we have exposure or an open field to actually really experience ourselves at a much higher level than when we move to condemning and judging.
Well, and as you know, as well as I do, right, the mind is so powerful. I mean, the placebo effect in a lot of these medications is almost equal to the like the I'm blanking on the word, the general effect, like the effect
Right.
of the medication. And
Mhm.
so if your intention with it is I'm going to take this and it's going to help heal,
Yes.
then that is very powerful in its own right. And that when you no longer feel like you need it, you don't need it anymore. But if the intention is you swallow that pill, I love the way you said that, is this is here to help heal me. It's another tool. I don't
Yeah.
think that Western medicine should be thrown. You don't throw
No,
the bait. There's
absolutely not.
wonderful things that we
Mhm.
can now treat as a result of this. I mean, people couldn't function, you know, people can go into very deep depressions and they cannot get themselves out of them. And
Mhm.
I had a supervisor who once gave me this visual that was so helpful, which was every time you sort of you have an experience of depression, you kind of fall down this little hole. And each time that hole gets deeper and deeper and deeper. What medication can help do is help fill that hole so you don't feel like it's as difficult to climb out of every time.
Yeah, absolutely.
And that's a beautiful image to think about when you're doing that.
Yeah,
Mhm.
yeah.
Well, and I
Um,
think, as you said, Robin, there are so many methods that it's a really about just following what feels true and good to you, because that's really the basis of what makes any of them work. And there's such a variety of ones available for people to
uh,
choose.
we'll let the group comment. Yeah. What we have taught and what we are continuing to teach is that everything that a human experiences is a good thing. And it is not something that should be changed or regretted. It is not something they should be judged for or condemned for. It is important that we really surrender to and accept ourselves in what our life has called us to be in the way that we feel in it. So we'll have a lot of people who perhaps will give you the example that they have had parents that have worked very hard, and in the hard work of 12 to 17 hours a day, they have seen some success in that. They have seen that their parents have done well and supported themselves well in that perception or belief. And so we will get a client before us who is being taught that they don't need to work that hard and that they could actually think their way into wealth and that they don't need to put the time and hours in. But what we try to teach people is to embrace in consciousness what they truly believe and allow themselves to view themselves with this higher aspect. So you can work 12 to 17 hours a day because it's so deeply rooted within you and you have such a deep perception and belief about it that it's probably going to serve you or work for you. But do it in consciousness. And by consciousness, we mean when we are aware and we observe ourselves in our perceptions and in our beliefs, they serve us. And so pretty soon what will happen is as you observe yourself in your long work days, in your struggle, in your belief that you have to work hard, as you keep calling yourself to observe it as this higher, grander divinity aspect of yourself, your consciousness will start to rise out of a place where effort and hard work are not a part of. And you will start to have the perception or belief that there is another way, and you will start to feel less fearful in taking another way. But there's no point in forcing or trying to push yourself out of a way that you presently unconsciously believe in. So we want people to observe themselves consciously, become conscious of what it is that they are choosing to believe that is creating in their experience, and provide themselves the opportunity to rise out of that way of being very naturally, you see.
Yeah. Thank you.
And thank you. That was amazing. That is exactly, I think, what psychotherapy can help people do,
Mhm.
is become aware of what those unconscious patterns, beliefs, messages have been
Mhm. Yeah.
and shift to consciousness. Sorry, go ahead.
It is to become aware and conscious, but with no need to make an adjustment or change what is felt, to just recognize that it is valid, that it is something life has called out of you, and that therefore you're going to honor yourself, love yourself, in your free will choice to pick and choose how you feel, and therefore you will become a match to the divine flow of love, unconditional love. This is what the requirement that the divine has, the only requirement it has. Many humans think that they have to do things differently, or they have to change, or they have to effort in their experience, and they really don't have to do that. You can actually be free. You can actually go on to live your life and become observant of it, and then be lifted out of it by that divinity part of yourself. Once a human discovers this tool, this key to happiness, to joy, to a higher level of consciousness that actually serves them in ease, the very nice natural changes that they are wanting to see in them actually already exist by everything that they have felt. So once they accept themselves in the way that they created it, which might have been in a little bit of suffering, they will pop up. They will rise up to a new level of consciousness where they create from happiness, joy, from being the person that they have wanted to feel and to be, you see.
Thank you.
So that's a little crazy, I have to say.
Mhm.
And when that
It's
started
amazing.
happening, I thought, what the hell is this? Now I'm
Right.
going to be known as crazy. Am I crazy? I don't know. I mean, something like that just comes out, and I happen telepathically to know what it is. And it's kind of like what you said when you get something, because you are an audible person. Sometimes you get it audibly, but sometimes you just get a knowing. Well, that's
Hmm.
telepathy. That's what that
Hmm.
is. That's the ability that everybody has, that everybody can communicate with.
Yeah, and I know when I have channeled, it feels, it does feel a little bit crazy. Like you do feel like
Yeah.
you're a little bit
It does. I
like,
have to kind of just pretend it didn't happen. I don't spend a lot of time watching it back, or, oddly, there's a really positive response to it. I have to say, it comes out in a lot of my sessions. It comes out in our group Kundalini activations,
hmm.
my private group activations. People cry. It has a frequency that seems to be healing in someone.
Yeah. Yeah. And I think those frequencies are because they're frequencies of love, right?
Mm,
They're frequencies of joy, of love, of contentment, of the frequencies of what the soul is supposed to feel when it's here.
yeah. I, for one, am very excited about what you're doing, and I love the way that you're doing it, and the way that you're not afraid to, come on a show like this and actually say the way that you're doing it. It's like you support both sides so evenly. No one could fault you for it.
Thank you. Yeah. And that's really why when I got started and I started to tell my story, the first thing I did before I even launched my podcast was to reach out to all the doctors who referred to me and
Hmm.
say, just want to let you know in the event that you refer someone to me and they go look me up, they're going to find this out. And I can no longer deny this part of myself, this part of my journey, similar to you, Robin, right? Like
Yeah.
this is now a part of
It's
who
like you
you
get driven
are.
and you don't know
Right.
how. Yeah.
Right. And no one blinked an eye.
Yeah.
They
There
were
you
all
go.
like, okay. And to me, that's just like you said earlier, Heidi, where are we, and Robin, you said it as well, in the evolution of consciousness, that to me is a step in the right direction of evolving consciousness, that people who might not necessarily believe it or think it is real are not shutting it down immediately. They know me, they trust me, they know I've been good for their patients. They want to continue to refer to me, and maybe they're a little bit more curious now because of it, because they think, okay, well, she seems normal, right? She's
Yep.
But
not,
in
doesn't
truth,
seem like she's grappling with mental
but in
illness.
truth, what's really happening is you're attracting to yourself in the frequency that you're emanating. And so there's never an outside cause. There's never one accepting you because of something that I'm not saying your work doesn't matter. It does matter. But what really matters is how you feel. And
Hmm.
what it is that you're actually holding is actually what's bringing you the response in connectivity to what you're choosing to do. So it's kind of interesting in the beginning when I used to find out, worry about people finding out that I was a
Yeah.
channel, because I've just been a normal everyday wife and mother and person.
Hmm.
And one of my biggest nightmares was somebody was going to Google me and find out what I was doing and think I was crazy. And I did get a little bit of that in the beginning, and it hurt me. I felt
Hmm.
uncomfortable about it. But what I was really surprised at is how quickly things started to transform in a way where I just kept going, and pretty soon it didn't bother me anymore. And further, I didn't get many people discovering me, or at least coming to me with that discovery. And so what I had fretted about just kind of evaporated. It just kind of didn't happen. Now it might be happening, but I'm not hearing about it. It's not having an
Right.
effect on me.
Right. And I
Right.
think you're absolutely right. It's once that I got to the place where I stopped caring
Hmm.
what people were going to say or think about me and just lived in my truth.
Yes.
It, no, again, maybe people are talking about me behind my back, but it's not penetrating me in any way. So some very similar experience to what you're describing.
Yeah,
Right.
yeah. I was laughing the other day because I had a little conversation in my mind about telepathy. I used to think telepathy was going to be an invasion of privacy. All of a sudden, you're going to go in front of somebody and you're going to be thinking something and they're going to know it. And I think that's going to be problematic. That's not really what telepathy is. Still an intended exchange. It's still something
Hmm.
that you want to communicate that actually happens. So it's kind of good to know that you basically have this very clear, precise communication with no misunderstanding because you shift up to a higher level of consciousness. Further, there isn't anything to hide because you don't have those thoughts that you normally
Hmm.
would be having in density. So there's this very open, really nice, rich exchange that you can have with people where there is no worry about what you're thinking because you're not thinking it because you don't have
Right.
access to those thoughts anymore.
Right.
So it's a good thing that's coming.
It's just
Right.
the bypassing of the filter in some way.
Yes, yes,
Mhm.
yep.
Yeah. So Amy, if our guests are interested in your services, can you tell us a little bit about everything you offer and how they would get a hold of you?
Absolutely. Thank you. So my website, Dr. Amy Robbins, has everything that's available to people. And I'm also on Instagram at Dr. Amy Robbins. Those are the Instagram is the best place to reach me. I have my podcast, Life, Death, and the Space Between, where I explore life. I say life, death, consciousness, and what it all means, but I go, as practical as talking about kind of traditional ways of healing to channelers. So I've had it all. And Robin, Athena, in truth, you will be on. I think I'm not sure if we have something scheduled, but if we don't, we're going to get it scheduled.
Great.
But and I have a couple of different courses. So first of all, my one course for therapists is getting launched. When is this going to air?
Probably within the next week,
Oh,
3 4 days.
perfect.
Yeah.
Okay,
Yeah.
perfect. So it's called Spiritually Informed Therapy. I'm doing an information session on June 3rd. This is for therapists specifically. It is continuing education credits that you could get for it, which means it's been validated by the National Board of Certified Counselors. So if you're a master's level therapist, not social worker, but therapist, you can get continuing education credits for it, which I think is amazing because it's saying we're
Mhm.
taking this seriously. And that was really important to me, is that I wanted people to come into this and have the opportunity to say, like, this is legit. I'm not just taking another spiritual course where I'm learning mediumship. And that's not actually what I'm teaching in the course. I'm teaching like all the different modalities of healing, neuroscience of spirituality, spiritual bypassing. So I'm looking at it through a clinical lens, but really wanting to get therapists who are interested in this work on the same page. So we're speaking the same language at this point. So that's something that's coming soon. That course is going to start June 16th. So the information session is June 3rd. And then I also run a course called Live Your Life Backwards, which is for the layperson. And that's really digging into learning some basic techniques around grounding, protecting, connecting, and digging into what is the essence, what is the core of what your soul is here to express, and how do you live from that place. And I incorporate a lot of different healing tools in that. We look at signs and synchronicities, how to use those in your life. We do dive into death a little bit because I think facing death, when you can really look deeply at when your physical body dies, what will you have wanted to do? How would you have wanted to live from the perspective of your soul, not from the perspective of the personality? It's a very, very powerful tool. So that I kind of am going to be rotating between those two. There's also a freebie on my website for discovering your essence. It's a little workbook and a meditation and a little portion of my course. So you can start to get a flavor for just how I work, how I teach, how I think about this work, because I really want to help continue to raise the consciousness of this planet. And I think we need it now more than ever.
Mm.
Well,
Well, I,
that's
for one, am so grateful to have had you come on today. You're a breath of fresh air, and
Thank you. This was
I think what you're
lovely.
doing is amazing.
Thank you. Thank you.
yes. Thank
Same
you
with
so
you.
much. Yeah.
Absolutely. Thank you for having me. I love this.
Thank you.